Hello, I'm Jamir and you're watching News Pulse on Hornbill TV. Now, news in details. A 50-bedded COVID-19 hospital was inaugurated by Minister of Health and Family Welfare S. Pangyupom at the District Hospital Dimapur on February 28. The hospital has been developed with the support from the Novo Nordisk Foundation Embassy of Denmark, Sea Camp, Bengaluru and Invest India through Agni Mission under the guidance of the Office of the Principal Scientific Advisor to the Government of India. This is a top acute care hospital for COVID-19 to be established post-pandemic. It was informed that eco-friendly materials were used to build the hospital, which would last for decades. The Health Minister reiterated that such privilege to be bestowed upon the Naga people was never imagined and expressed his gratitude to the various stakeholders. He said that the COVID-19 hospital, which was inaugurated today, is one of the most required and needed facility to cater to the people's needs with all the advanced equipments which will enable for timely care and proper treatment. Various dignitaries also spoke at the event, including Freddie Swabe, the ambassador to the India from the Royal Danish Embassy at New Delhi, who spoke virtually at the event.
Gateway district for the state of Nagaland, and Dimapur district is the place which has the maximum volume of commercial transactions and movement of people, transit of people from into and out of the state. And Dimapur district has the only railhead of the entire state and also the only airport present in our state. We see a lot of students from across the border from the other state as well coming in. They attend schools and colleges here, and a lot of laborers from other states also they come in, and then so that makes a lot of floating population in Dimapur. And having said that, this makes Dimapur one of the most vulnerable hotspots as far as the COVID-19 pandemic is concerned, and that's what we exactly witnessed also. Till now, Dimapur district always had the highest percentage of the COVID-19 cases in the state. Today we may have less number of cases, but then the COVID-19 pandemic has taught us the importance of preparedness for any eventuality, especially that we don't have any timeline for the end of pandemic in sight, at least as of now. So that has really put us in a place to appreciate the level of preparedness, and this timely help from the Royal Danish Embassy for our district. I extend my sincere thanks and appreciation to them.
Today is the most significant day for the people of the state, and Dimapureans in particular, to have inaugurated the 50-bedded COVID-19 hospital at your doorsteps. All these years, our state have been tackling with this COVID pandemic, pressing on with all of our manpower, facilities, and resources, like with the rest of the world, to overcome this health crisis. We have lost many good precious lives, and everything was badly affected by this unprecedented virus of COVID-19 pandemic. However, we have never given up our fight in this battle, which is still on. I also want to mention that the state government and the department with an objective to help assist to provide better health facilities in the state. 3 new district hospitals buildings will be coming up in due course of time, which includes District Hospital Dimapur, District Hospital Doklak, District Hospital Longling.
We have here the Minister of Health and Family Welfare, S. Pangyupom. Sir, thanks for speaking to Hornbill TV. Sir, Dimapur and Mukokchung have been chosen and now inaugurated today. It was in Dimapur, the 50-bedded COVID-19 hospital. And in the next 3 months, it was said that Mukokchung will be. But what about the other areas of Nagaland, especially the remote areas where connectivity is not there? So if there's no road connectivity, how can people avail these services?
Actually, this is the only beginning. Today we have inaugurated in Dimapur, and Mokchong will be within 3-4 months' time. And after that, we are planning to take up other district headquarters, also the interior districts. So it all depends on the government of India and also the donors.
So any plan on other organizations or funding coming in from other organizations, or is it what today the Nordisk Foundation or the Government of India or Embassy of Denmark?
Some corporate and some donors and some NGOs are funding. And a small way, like a MON, there are one NGO, Haas Foundation. So they are taking care of the pocket of the area that most deprived and interior areas. So they are also working hard with the collaboration of the district administration and the department.
Lastly, in a bigger picture for Nagaland, when do we expect the best quality healthcare system for Nagaland, for every nook and corner of Nagaland? When do we expect the best healthcare facilities?
Oh, we are trying our level best. The state government as well as Government of India, Minister of Health and Family Ministry is supporting us. So I cannot give you guarantee. But hopefully with the 15th Finance Commission grant, that is for next 5 years, starting from this year, I think many of the health sectors, especially the interior area, I think by this 15th Finance Commission grant, changes will come up.
My name is Mudit Narayan. I'm the Chief Technology Officer at the Office of the Principal Scientific Advisor to the Government of India. And our role was to facilitate foreign funding for the implementation of 7 such hospitals in 5 different states, including 2 in Nagaland.
So it was mentioned earlier that Mokokchung would be one, but why was Dimapur chosen and Mokokchung chosen to have these COVID-19 hospitals?
We reached out to several states. The states which had a little shortfall of medical services and which were not very close to large centers like metros or large cities were chosen so that this could be the facilities could be ramped up quickly and facilities could be taken to the citizens, to the patients, rather than them having to travel to cities. And Nagaland was chosen because we wanted to make sure that Northeast was properly covered. Just yesterday, we inaugurated a 54-bed facility in a place called Uloni in Nagaon district in Assam. And today here in Dimapur, another one is coming up in Nagaland in Mukokchung, one in Meghalaya. We also set up facilities in Punjab, smaller cities of Punjab, and one in Haryana, which is a slightly larger one. So the idea was to spread out as much as possible, and the foundation's funding and our office was able to get a match of different kinds of states, different kinds of facilities. And also this facility is special because it is made by agricultural residual waste, and this is a new technology which has been certified for decades, and yet it was built in barely 48 days, and will survive for at least 10 years and could even survive up to 30 years. So this is like medical infrastructure, and not just for COVID, but like medical infrastructure generally.
And sir, yes, Dimapur and Mukokchung, but is there any plans to also, considering that healthcare facilities is much needed more in the remote areas than Dimapur or Mukokchung, because their connectivity is pretty okay right now to, road connectivity and all. But the remote areas, I think they're the ones that need the most of, healthcare facilities. So, sir, would you like to comment on that and why, the funding is going to places like Dimapur and Mukokchung, but not in the remote areas where it is much more needed?
Right. So our office offered the facility the funding to the state, and the state made the decision of which cities to go for. However, we think that this was just a model. this was an emergency situation where we chose how things could move quickly. But the companies and the entire model is available for the government to scale up. So, and as you saw, this can be done in less than 2 months, and the government now knows how it is done. They've seen it being done, so they are very welcome to approach the same partners and do this in whatever locations they